Welcome back to our show. I'm Dr. Kesty, and I'm joined by my sister, also Dr. Kesty. We're from St. Petersburg Skin and Laser, and today we're going to be talking about under eye options. Okay, so Dr. Kesty, what's your approach for PRP, or what's your thoughts on that?
So I love Platelet-Rich Plasma, or PRP, for the under eyes for patients. We take a small tube of blood, we spit it down in our centrifuge, we take out the growth factors, and we inject it under the eyes. I like to do this as a procedure by itself, or when I'm doing lasers, either for regular laser resurfacing on the face or eye rejuvenation lasers, I'll end the case with using a little bit of ice, or if the patient's already numb, I'll just go ahead and inject it right into the under eyes. So I like it by itself. I like it in combination with lasers. I like that it is kind of a booster to any laser procedure under the eye, because it's going to help build collagen kind of from the inside as well as from the outside with the laser. So you just get a really, really beautiful natural result. By itself, the Platelet-Rich Plasma, I also like for patients who do want that more natural result. You're going to get a little bit of volume over 6 to 12 months after the PRP injections, but it's not going to be an instantaneous volume like adding a dermal filler. And it's not a 1-to-1. If we're adding 1.5 to 3 cc's under eyes of Platelet-Rich Plasma, in 6 months, you're not going to have 1.5 to 3 cc's of volume under the eye, which for most people would be quite unnatural looking. So I love that it's a really, really natural result for patients. I love PRP because it is derived from the patient's own growth factors. It's kind of an all-natural treatment for patients. And I also love that there's no risk of the stroke and blindness with the Platelet-Rich Plasma as with dermal filler under the eye. So you're basically taking that risk, which is a small risk, but it is a known risk with the dermal filler under eyes, and you're taking it down to essentially zero. I mean, there's always a risk that you'll have a small bruise of Platelet-Rich Plasma under the eye, but you're not going to have a stroke, go blind, have a vascular occlusion like the risk with dermal fillers. Overall, I love it for under eye rejuvenation, Platelet-Rich Plasma, either by itself or in combination with some laser resurfacing or laser eye rejuvenation.
I agree. I think it's really natural results, but also low risk. So it's almost like there is a benefit, but also no drawbacks to that procedures.
I feel like a lot of our patients come to us because we really specialize in the all natural results. And I think that they are drawn to us because they see our before and afters that are very natural, that subtle enhancement of your natural beauty. So that kind of draws more patients who want that. So we kind of build a patient population based on people who want to look better, maybe 5, 10, 15 years younger, but still maintain their natural contours, still kind of be able to show up to work after a procedure and no one doesn't recognize them. All their friends still think that they look like themselves, just, younger, more refreshed, rejuvenated, like they had a really, really good night's sleep.
I agree. I mean, I think the best compliment that I receive from my patients are, they went back to work and people are telling them their skin looks really good or you look really refreshed, but they can't actually tell you what exactly happened. And I think that's a really huge benefit of things that we do. When you go do some more invasive procedures, you can say, okay, you did this. But at this clinic, we kind of maintain that, it's almost like our little secret, right? We thought we did this procedure, you look great, but no one can say, oh, you exactly did this. They can't really kind of pinpoint what procedure you got done.
Next, let's talk about lasers for the under eye, because now we've talked about PRP by itself and with lasers. So let's really hone in on lasers for the under eye. And I know you're the world expert on laser blepharoplasty, which is the upper eyelid. So I'll let you talk about the lower eyelid. What's your approach? Tell us about it.
We call this eye rejuvenation, but basically I'm using a combination of CO2 and erbium lasers, both in their fully ablative capacity, and really tightening from the outside in and using a lot of that heat damage to get rid of those crinkly wrinkles, get rid of the hollowing, help with that kind of blue tinge or the pigment tinge underneath the eye. And those are really nice results. The healing time's a little bit longer, up to 2 weeks of kind of redness, oozy goozy, but the patients are really happy after they've gone through that procedure because of the kind of nice enhancement of the under eye area.
I think it's really interesting that a lot of my initial cosmetic consults, when they're coming in to talk about eye rejuvenation, they've kind of reached a certain age and they're realizing that you can get rid of these wrinkles with Botox kind of lateral to or on the side of the eye. But the under eye wrinkles, unless you laser them, it's really, really hard to There's not really anything else that gets rid of those wrinkles other than doing a fully ablative laser under eye.
I agree with that. I mean, I have some younger patients. I mean, even in the older population, ask for Botox, that kind of jelly roll right in through here.
Mhm.
And that can help minimize that. But again, it's not really going to kind of resurface, especially in the inner corner of the eye or that whole kind of skin quality. That's not going to change. It's really just kind of in that smile. You're not making that squinty look, but that's really the only thing that Botox in that area can do.
And it's such a great rejuvenation just to improve skin quality by, 10, 20 years in that small little area, the under eye and the upper eyelid. If they're not doing a laser bluff with you, we'll do the full eye. And just that change in skin quality can make someone look so much younger, so much more refreshed. It's just such a change in their whole facial structure because that skin quality has just improved so much with laser under the eye.
Yeah, I mean, we treat all the way up to the lash line on both of the lower lids. And if we're doing the upper lids at the same time, then we do that. But really treating all the way up to the lash line is really helpful because you want the tightening all through that area, not just, in through the orbit where you can kind of see that darkening starting, but actually all the way up to that lash line. And that really helps with the results that we're getting in our patients for sure. All right, so tell us about vascular laser underneath the eyes.
I love doing vascular laser under the eyes, and there's two things that I'm really focusing on when I'm doing vascular laser under the eye. The first one is those blue veins that can show up for some people, and this can be genetic, it can be sun damage, it can be age, and they can become quite prominent under the eye for some patients, and it can cause a lot of kind of what people call dark circles. It's actually just blue veins. So what I'll do is I will put metal contacts in their eyes to protect their eyeballs from the laser and use a 1064 laser to treat those veins. The average number of sessions is somewhere between 2 and 3 to have about a 90% resolution of those veins. It doesn't hurt. There's no pain involved. There's no downtime. It's a really, really nice procedure. If you notice that you are someone that has those blue veins causing some of the blueness under your eyes. The other thing that I like doing with vascular laser under the eyes is I like treating kind of the whole area with either a 532 or a 1064 laser. And that just kind of brightens. It can pick up some of the smaller veins, red and blue veins that can cause some of the darkness under eyes. It'll stimulate a little bit of collagen, reverse some of the sun damage. So I love that as well, kind of as a standalone treatment. If patients don't have the downtime, 7 to 14 days for a full eye rejuvenation case, while we're waiting for them to open up that time in their schedule, sometimes we'll do some really light resurfacing lasers on the face and then do that under eye combination of treating the veins and treating some of the blueness, and they'll get a really, really good result. They won't get as much skin tightening as doing a laser resurfacing procedure, but they will still get a little bit of rejuvenation just by decreasing the amount of blue that people see when they look in their face.
It's a really nice option, especially for people who don't have the downtime of the, 7 to 14 days, because we can just put those contacts in, get rid of most of that blue. Again, that happens because the collagen is breaking down over time. And as we age, that becomes more prominent, and we're seeing a lot more blue and red in and around the eye, which contributes to the overall kind of look of our eyes aging. So if they don't have the downtime, this is a no downtime, kind of no pain, but a lot of gain from that procedure. And that's, really important to a lot of our patients.
I'm always really pleasantly surprised by our patients who come to us in their initial cosmetic consult, and maybe they're on TV or speaking all the time, or they just really don't have like any true downtime. Sometimes we're waiting like 6-8 months for them to find 7 to 14 days downtime for a true laser resurfacing procedure. And so a good option is to do vascular laser on the full face and then vascular laser under eyes. And they do so well with just a vascular laser, 532, 1064. There's so much rejuvenation that happens that it's always just an amazing, post-laser visit for me and the patient to look at their before and afters, because it's such a subtle thing. Like, people don't come to my initial cosmetic consult and say, hey, I want vascular laser. Very rarely does that happen, but we don't see in our own face how much having these red veins, having these blue veins is aging us, is making us look tired and like we've been out in the sun a lot. And just by treating that with no downtime, it's just a really amazing cosmetic result. So I know we're off topic because we're talking about vascular face, but usually if I'm doing vascular under eyes, I'll do vascular face too. And even that with no downtime is just such an amazing result that I love doing for patients. So
Yeah, we get some nice, really even skin tones.
So thank you so much for listening to our episode about under eye rejuvenation options. If you have any questions, please don't hesitate to drop us a DM or leave us a comment on this video. And thank you so much.
We'll see you next time.